Mifeprex, also known as Mifepristone or Ru-486, is a medication used to end an early pregnancy, up to 10 weeks, or 70 days, after the first day of your last menstrual period. It works by blocking a natural substance called progesterone, which is essential for the pregnancy to continue. Mifeprex is typically used in combination with another medication called misoprostol. It's important to note that Mifeprex should not be used if you have an ectopic pregnancy, which is a rare abnormal pregnancy that occurs outside of the womb. In this case, Mifeprex will not end the pregnancy and may actually cause the ectopic pregnancy to rupture, leading to serious bleeding. As for the dosage and timing, Mifeprex should be taken as directed by your healthcare provider. They will provide you with specific instructions on how to take the medication and when to take it. It's crucial to follow these instructions carefully to ensure the safe and effective use of Mifeprex. Before starting Mifepristone, make sure to read the medication guide provided by your doctor and sign the patient agreement form. If you have any questions, consult your doctor or pharmacist. You will need to visit your doctor at least 2 times during your treatment. This treatment is only given under direct medical supervision. Your doctor may order an ultrasound to make sure your pregnancy is less than 10 weeks and is not outside the womb, ectopic. Take Mifepristone by mouth as directed by your doctor, usually as a single dose. After taking Mifepristone, your doctor should direct you to wait 24 to 48 hours before taking another medication, misoprostol, by mouth as a single dose. Follow your doctor's instructions carefully. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. It is important that you return for a follow-up visit within 7 to 14 days after taking Mifepristone, even if you are not having any problems. If the pregnancy has not ended, or there are serious medical problems, surgery may be needed. If the treatment fails and the pregnancy continues until birth, there is a risk of birth defects. You may experience nausea, vomiting, diarrhea, weakness, or dizziness after taking Mifeprex. If these effects last longer than 24 hours after taking the second drug, misoprostol, seek medical help as they may indicate a serious medical problem. Bleeding and cramping are normal during this treatment and usually mean the drugs are working. However, it is still possible to have cramps and bleeding and still be pregnant. Make sure to attend all follow-up visits with your doctor. Nausea and cramping may worsen within 24 hours after taking the second drug, misoprostol, and your doctor may prescribe other medication to help with these symptoms. If any effects persist or worsen, notify your doctor or pharmacist immediately. Bleeding and spotting may last up to 30 days and may be heavier than a normal period. In rare cases, surgery may be needed to stop the bleeding. Seek medical help if you experience enough bleeding to soak through 2 thick, full-size sanitary pads each hour for 2 hours in a row, or if you are concerned about heavy bleeding. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. Seek medical help immediately if you experience a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher, fainting, fast heartbeat, or stomach/abdominal pain or tenderness. A severe allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. If a pregnancy ends, there can be serious medical problems, including sometimes fatal infections and bleeding. Before taking Mifeprex, it's important to read the medication guide, sign the patient agreement, and consult your doctor if you have any questions. In the United States, you must understand, agree to, and carefully follow the requirements of the Mifepristone REMS program to receive this medication, while in Canada or other countries, it's important to consult your doctor and pharmacist for your country's regulations. Your doctor should give you clear instructions for who to call and what to do in case of an emergency, such as severe bleeding or infection. If you need to go to the emergency room or visit another healthcare professional, be sure to show them the medication guide so they know you are trying to end your pregnancy. It's important to seek medical help right away if you experience symptoms such as severe abdominal pain, fainting, fast heartbeat, or a fever lasting more than 4 hours, as these could be signs of a very serious infection. If you have continued heavy bleeding, or if you have abdominal pain or feel sick, such as nausea, vomiting, diarrhea, weakness, more than 24 hours after taking the second drug, misoprostol, it's important to get medical help right away, even if you do not have a fever. These symptoms could indicate the pregnancy has not ended or another serious medical problem, requiring surgery or other medical care. See also the side effects section for more information. Before taking Mifepristone, it's important to let your doctor know if you are allergic to it, misoprostol, other progestins, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Before using Mifepristone, inform your doctor or pharmacist about your medical history, especially if you have undiagnosed abdominal growth, adrenal gland problems, certain blood disorders, bleeding problems, or low blood count. If you are using an IUD for birth control, it should be removed before starting Mifepristone treatment. It's crucial to use this medication only if you have easy access to emergency medical services in case of a serious medical problem. Mifepristone may cause dizziness. Avoid alcohol or marijuana as they can increase dizziness. Refrain from driving, using machinery, or any activity requiring alertness until you can do so safely. Limit alcoholic beverages and discuss marijuana use with your doctor. Mifepristone usually causes fetal death. If by chance there is an ongoing pregnancy after treatment, birth defects may result. Another pregnancy can occur after treatment with Mifepristone and before your normal period resumes. Birth control can be started as soon as treatment is completed. Consult your doctor for more information. This medication passes into breast milk, and the effects on infants are unknown. Breastfeeding women should consult their doctors on whether they should discard their breast milk for a few days following this treatment. It's important to be aware of potential drug interactions when taking Mifeprex. This medication may interact with other drugs, increasing the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Mifeprex include long-term corticosteroid therapy, other drugs that can cause bleeding or bruising, and aspirin. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. There are also other medications that can affect the removal of Mifeprex from your body, which may affect how it works. Examples include azole antifungals, macrolide antibiotics, and drugs used to treat seizures. On the other hand, Mifeprex can also slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include cyclosporin, fentanyl, and statin drugs. Always consult your doctor or pharmacist for more details on potential drug interactions with Mifeprex. If you or someone you know has taken too much Mifeprex and has severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe vaginal bleeding. It's important to seek help right away if you or someone you know is experiencing these symptoms. Medical professionals may conduct lab and/or medical tests, such as an ultrasound, while you are taking Mifeprex. It is important to attend all scheduled medical and lab appointments. Be sure to consult your doctor for more detailed information. It's important to follow the dosing and appointment schedule as directed by your healthcare provider. If you happen to miss an appointment, make sure to get in touch with your doctor as soon as possible. Now, let's talk about the uses of Mifeprex. Mifeprex is a medication that is used in combination with another medication called misoprostol to end an early pregnancy. It works by blocking the hormone progesterone that is needed for the pregnancy to continue. Mifeprex is only available through a doctor's prescription and should be stored at room temperature, away from light and moisture. It's important to keep all medications away from children and pets, and to properly discard any expired or unused medication. It's also important to follow your doctor's instructions on how and when to take Mifeprex, as well as when to take the accompanying medication, misoprostol. Always consult with your pharmacist or local waste disposal company for proper disposal of Mifeprex. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.